Bone health. It's something many overlook until aches, fractures, or stiffness start taking over after 50. Imagine waking up one morning with a sharp pain in your hip or wrist, so severe that even simple movements become a challenge. According to Dr. Emily Harper, a leading orthopedic specialist, bone loss is often called a silent epidemic because it progresses unnoticed until serious damage occurs. Research from the National Osteoporosis Foundation shows that nearly 1 in 2 women and 1 in 4 men over 50 will experience a fracture due to weakened bones. The surprising truth? Most people focus solely on calcium, ignoring other vital vitamins that work together to keep bones strong and resilient. Are you missing these crucial nutrients? If you're over 50 and worried about your bones, this video is for you. Every year, millions suffer fractures caused by osteoporosis, a silent thief that weakens bones without obvious symptoms until it's too late. But here's the good news. There are 5 powerful vitamins proven to protect and strengthen your bones naturally. We're diving into these vitamins, from vitamin D to phosphorus, explaining why each one matters, how to spot signs of deficiency, and what foods and supplements can help. One vitamin you probably think about, but the other 4 might surprise you with their hidden power. Which vitamin directs calcium straight to your bones? Which helps prevent artery calcification? Stay tuned. Number 3 on our list is especially critical after 50. Ready to protect your bones? If you want to protect your bones, don't forget to like this video and subscribe for more health tips. Let's talk about vitamin D, one of those crucial vitamins you don't think about until your bones start sending warning signs. After 50, your body's ability to produce vitamin D from sunlight decreases, making it easier to develop bone loss silently. If you think calcium alone is enough for strong bones, think again. This vitamin plays a key role in keeping your skeleton healthy and resilient. Vitamin D levels drop quietly in adults over 50, especially those who spend a lot of time indoors or live in less sunny climates. This deficiency doesn't just affect your bones, it also impacts muscle strength, balance, and immune function, all critical for staying active and preventing falls. Without enough vitamin D, calcium absorption drops drastically, leading to fragile bones that are more likely to fracture. Low vitamin D causes poor calcium absorption, weak bones and muscle weakness, increased risk of falls and fractures, less mobility and sun exposure, even lower vitamin D levels. This vicious cycle can accelerate bone loss if left unchecked, increasing the risk of osteoporosis and other complications that impair quality of life. Signs of vitamin D deficiency can be subtle and easy to miss. You might experience persistent bone pain or tenderness, muscle weakness or cramps, especially in the legs, fatigue even after a good night's sleep, difficulty balancing or frequent falls, mood changes like feeling down or depressed, slow healing of injuries. Because these symptoms overlap with normal aging, many overlook them, not realizing low vitamin D could be the root cause. Vitamin D deficiency doesn't just weaken your bones, it impacts multiple systems. Bone remodeling slows down, causing brittle bones and higher fracture risk. Muscle loss increases, which contributes to falls. The immune system weakens, raising vulnerability to infections. Recent studies suggest low vitamin D may also affect cardiovascular health and cognitive function. On the cellular level, insufficient vitamin D disrupts calcium balance inside bone cells, impairing their ability to regenerate and maintain bone density. Ignoring these hidden effects can lead to chronic health issues that go beyond simple bone loss. Vitamin D is essential for activating calcium absorption in the intestines. It binds to receptors in your cells and triggers proteins that transport calcium into your bloodstream, where it can be deposited into bones. It also regulates parathyroid hormone, which controls calcium release from bones. Without enough vitamin D, calcium absorption drops to as low as 10 to 15%, compared to 30 to 40% with sufficient levels. This deficiency impairs bone mineralization, making bones softer and more prone to fractures. You can boost vitamin D naturally by including fatty fish like salmon, 100% DV in 3.5 ounces cooked, mackerel and sardines, fortified dairy and plant-based milk, egg yolks, mushrooms exposed to sunlight. These meals not only taste great, but also give your bones a nutritional boost. Vitamin D3, cholecalciferol, supplements are preferred because they mimic the natural form your body produces. Typical doses range from 800 to 2000 IU daily for adults over 50, but your doctor might recommend a blood test to tailor dosage. Avoid vitamin D2 supplements, which are less effective. Also, fat-soluble vitamins like vitamin D need to be taken with meals containing fat for better absorption. High doses without medical supervision can cause toxicity, so always consult a healthcare provider. If you've been feeling weak, tired, or worried about your bone health after 50, vitamin D might be the missing piece. The good news is, with simple changes like getting more sunlight, eating vitamin D-rich foods, or supplementing wisely, you can strengthen your bones and protect your independence. Don't wait until fractures happen. Take action today. If you found this helpful, like and subscribe for more health tips. Let's dive into vitamin K2, a vitamin many overlook when thinking about bone health. After 50, even if you're getting enough calcium and vitamin D, without K2, your body can't use calcium properly. This silent vitamin plays a crucial role in directing calcium to your bones and keeping it out of your arteries. Missing out on K2 could be quietly undermining your bone strength and cardiovascular health. Vitamin K2 levels tend to drop with age, especially in people over 50 who might not consume enough fermented foods or certain cheeses. Without adequate K2, calcium can build up in soft tissues instead of strengthening your bones. This increases the risk of osteoporosis and artery calcification, which raises cardiovascular risks. For aging adults, maintaining K2 levels is essential not only for bone density, but also for overall heart health, making it a vitamin you can't afford to ignore. Low vitamin K2 means calcium doesn't get properly activated to bind in the bones. Bones become weaker and more brittle. Calcium starts depositing in arteries, leading to stiffening. Cardiovascular health declines. Reduced blood flow affects nutrient delivery to bones, accelerating bone loss and cardiovascular risks. This cycle is often unnoticed because K2 deficiency symptoms are subtle but can have serious long-term consequences. Vitamin K2 deficiency symptoms can be hard to detect early but may include easy bruising or bleeding due to poor blood clotting, frequent bone fractures or slow healing of broken bones, joint pain and stiffness, fatigue and muscle weakness, increased risk of arterial stiffness, which may show as high blood pressure or cold extremities. Since these symptoms can overlap with normal aging or other conditions, many people remain unaware of their K2 deficiency until complications arise. Beyond bone loss, low vitamin K2 impacts multiple body systems. Bone health suffers because K2 activates osteocalcin, a protein essential for binding calcium into the bone matrix. Without it, bones lose density and fracture risk rises. Cardiovascular system is at risk as calcium deposits in arteries cause stiffness and plaque buildup, increasing chances of heart attacks and strokes. Kidney function may decline due to calcification. There is emerging evidence linking K2 deficiency to impaired insulin sensitivity and metabolic health. On a cellular level, K2 helps regulate calcium channels and enzymes critical for bone remodeling and vascular health. Ignoring these hidden damages can worsen overall health outcomes over time. Vitamin K2 activates proteins like osteocalcin and matrix GLA protein, which bind calcium to the bone and prevent it from depositing in arteries. It acts as a calcium traffic controller, ensuring calcium strengthens bones rather than clogging vessels. This process is vital for maintaining bone mineral density and arterial flexibility. Without K2, calcium's journey is misdirected, contributing to brittle bones and arterial calcification, which can cause serious cardiovascular issues. Boost your vitamin K2 intake with these foods. Natto, fermented soybeans, one of the richest sources. Hard cheeses like Gouda and Edam. Soft cheeses, yogurt, and other fermented dairy products. Egg yolks, chicken liver, and other organ meats. Including these regularly in your diet can support healthy K2 levels. For instance, a small serving of natto or a slice of aged Gouda can provide significant amounts of vitamin K2. Vitamin K2 supplements come mainly in two forms: -4 Malawian kwaches and -7 Malawian kwaches. -7 Malawian kwaches is preferred for bone health because it stays active in your body longer. Typical doses range from 90 to 200 micrograms daily for adults over 50. Look for supplements combined with vitamin D3 for enhanced effects. Avoid synthetic or low-quality supplements with fillers or poor bioavailability. If you're on blood-thinning medication, consult your doctor before starting K2, as it affects clotting. Certain factors can reduce K2 effectiveness. Poor gut health reduces K2, producing bacteria. High doses of vitamin A and E supplements may interfere with K2 metabolism. Antibiotic use can kill beneficial gut bacteria that produce K2. Diets low in fermented foods and dairy limit natural K2 intake. Improving gut health and consuming K2 rich foods regularly can help prevent deficiency. If you want stronger bones and a healthier heart after 50, vitamin K2 could be your secret weapon. Don't let silent deficiency put you at risk for fractures or cardiovascular problems. Start adding K2 rich foods to your diet or consider supplements after consulting your healthcare provider. Take charge of your bone health today, and if you found this helpful, please like and subscribe for more wellness tips. Calcium. It's probably the first thing you think of when it comes to bone health. But many people don't realize that simply consuming calcium isn't enough to prevent bone loss after 50. Your body's ability to absorb and use calcium changes as you age. Without the right support, calcium may not reach your bones where it's needed most, leaving them vulnerable to fractures and weakness. Calcium levels tend to drop in adults over 50 due to reduced absorption in the gut and changes in hormone levels. Since bones store over 99% of the body's calcium, insufficient calcium availability directly weakens your skeleton. This is especially critical for postmenopausal women who face rapid bone density loss. Without enough calcium, your bones become porous and fragile, increasing the risk of osteoporosis and breaks. Low calcium intake or absorption leads to the body pulling calcium from bones to maintain blood calcium levels. Bones weaken, fractures, and pain increase, mobility decreases, less physical activity causes further bone loss, calcium absorption and retention decline. This cycle worsens over time, making bone health maintenance essential to break it early. Calcium deficiency can cause muscle cramps and spasms, numbness or tingling in fingers and toes, fatigue and weakness, brittle nails and dry skin, tooth decay and dental issues, increased risk of fractures with minimal trauma. Many people confuse these symptoms with aging or other conditions, delaying diagnosis and treatment. Calcium deficiency affects more than bones. Impaired muscle function, leading to weakness and falls. Nervous system disruptions causing tingling and spasms. Dental problems like tooth decay and gum disease. Heart rhythm irregularities in severe cases. On a cellular level, calcium regulates signaling pathways essential for bone formation and muscle contractions. When deficient, these processes falter, accelerating bone loss and functional decline. Ignoring these hidden effects can compromise quality of life and independence. Calcium is vital for building and maintaining bone structure. It forms hydroxyapatite crystals, the mineral matrix giving bones their strength and rigidity. Beyond bones, calcium regulates muscle contractions, nerve signaling, and blood clotting. The body tightly controls blood calcium levels, and when dietary intake is low, it extracts calcium from bones to compensate, weakening them over time. Adequate calcium intake ensures bones stay dense and resilient. Good sources of calcium include dairy products like milk, cheese, and yogurt, leafy greens such as kale and collard greens, fortified plant-based milks, almond, soy, oat, tofu set with calcium, sardines, and canned salmon with bones. Including a variety of these foods daily helps maintain calcium levels. For example, a cup of yogurt provides about 30% of the daily calcium needs. Calcium carbonate and calcium citrate are common supplements. Calcium citrate is better absorbed, especially for older adults or those with low stomach acid. Typical doses range from 500 to 1,200 milligrams daily, divided into smaller doses for optimal absorption. Avoid taking more than 500 milligrams at once. Excess calcium supplements without vitamin D can lead to kidney stones or arterial calcification, so it's best to supplement under medical guidance. Calcium remains a cornerstone of bone health after 50, but it needs the right support to work effectively. Pair your calcium-rich diet with vitamin D and other bone-friendly nutrients to keep fractures at bay. Don't wait for a fall or fracture to take action. Start nourishing your bones today, and if this video helped, please like and subscribe for more bone health insights. Next one, magnesium. It is one mineral many forget until it's gone. After 50, magnesium levels drop, affecting bone strength and muscle function. Without enough, bones weaken quietly, increasing fracture risk. Let's explore why magnesium matters and how to keep your levels healthy. Magnesium deficiency is common in adults over 50 due to lower intake and absorption. It's vital for bone formation and muscle relaxation. Low magnesium increases fracture risk and muscle cramps, making daily life harder. Keeping magnesium balanced supports strong bones and overall health. Low magnesium reduces bone strength, causes muscle cramps and falls. Less activity lowers magnesium further, bones weaken more. This cycle accelerates bone loss if not addressed, especially in older adults. Breaking it is key for healthy aging. Signs include muscle cramps, fatigue, tingling, and restless legs. These often get mistaken for aging or stress, but can indicate magnesium loss. Early recognition helps prevent bone weakness and injury. Magnesium deficiency affects bones, muscles, nerves, and the heart. It slows bone repair, weakens muscles, increases nerve pain, and may cause irregular heartbeats. Addressing deficiency protects multiple systems, not just bones. Magnesium activates enzymes that build bone and regulate calcium. It helps muscles relax and nerves function. Low magnesium disrupts these processes, causing stiffness, cramps, and weaker bones. Eat pumpkin seeds, spinach, almonds, dark chocolate, and avocados. These foods provide magnesium and other bone-supporting nutrients, helping maintain strength naturally. Try miso-glazed salmon with sesame spinach or almond-crusted fish with sautéed greens. These dishes are tasty ways to boost magnesium and support bone health. Magnesium glycinate and bisglycinate absorb well and ease muscle cramps. Avoid magnesium oxide, which absorbs poorly and may cause digestion issues. Consult a doctor before supplementing. Limit sugar, processed grains, caffeine, and alcohol. These reduce magnesium absorption or increase loss, worsening bone health. Healthy habits support magnesium levels. If you have cramps, fatigue, or weak bones, magnesium might be the missing link. Eat magnesium-rich foods or consider supplements to strengthen bones. Take control of your health today. If you found these tips helpful, please like this video and subscribe to our channel. We share science-backed advice every day to help you live healthier and stronger at every age. Don't miss out on the latest insights to support your bone health and overall wellness. Your journey to better health starts with a single step. Take that step today.